Welcome back to On the Move with Victor Shi. It is Friday, February 17th, and today we're going to be talking about COVID because it is still with us. In fact, latest COVID data shows that the 7-day average for COVID deaths is above 350. But what's even more concerning to me is that for those who do catch COVID, there's something called long COVID, and those are the symptoms that remain with someone who contracted COVID even after they test negative. So today we're going to be talking about where we are in the pandemic, what we should be doing to adapt to this virus going forward, and what it'll take to get people to get the full booster shot and to get vaccinated. I'm grateful to be joined by someone who is a leading voice on this, Dr. Eric Feigl-Ding. He is a public health scientist who is currently an epidemiologist and is the co-founder of World Health Network. Previously, he was a faculty member and researcher at Harvard Medical School. It's great to see you, Eric. Thanks so much for joining us.
Thanks for having me.
Of course. So let's talk about where we are right now. We're nearly 3 years out from when the world basically shut down from COVID. Where do we find ourselves right now when it comes to the pandemic?
Yeah, thanks for having me. I think the pandemic is not over, no matter how people try to imagine that, it's returned to normal. Because we're still having, a pretty high number of hospitalizations. By the way, hospitalizations have stopped dropping. They've actually U-turned in the last 2 weeks and are going back up again. And deaths, in terms of excess deaths, this winter has still been really, really bad. It's not as bad as last winter, but still about 50% of last winter in terms of excess deaths. So, and most of this, is not just the flu. Most of this is still COVID. So I think
is that a new COVID strain, or is it?
Yeah, so the new COVID strain right now is XBB.1.5. The X stands for a crossover strain of two different strains. We've gotten to that stage where now the strains are having like divergent progenies of each other. So and by the way, the new strain is more different than the original Wuhan strain. Than the Wuhan strain was from the 2003 original SARS. So in terms of evolution, we're very far away from Kansas now, away from the Wuhan strain.
Yeah.
But that's why the vaccines, they're not infection prevention vaccines anymore. They're more hospitalization and death reduction vaccines because of how far. And booster rates for the new Omicron booster is abysmal. It's like less than 10% in Trump heavy counties, and even in liberal counties it's only like 20%, 25 tops. So the uptake of boosters for the new strain has not been great either. Altogether, there's just way too much pacifism and blaseness.
Yeah. Well, I want to talk to you about the vaccines later on, but first, I something that's on my mind is this thing that I've been hearing a lot, which is long COVID.
Right.
Can you explain that to us more and how common long COVID is?
Yeah, long COVID is basically this persistent syndrome of COVID beyond just the I'm over my cough.
Yeah,
It's
yeah.
more than just a cough. Some people think it's just a persistent cough. It's not just that. We're talking about brain fog. We're talking about some people have gray matter loss based on MRI, memory loss, and it's also cardiovascular disease. After you have COVID, you're at increased risk of cardiovascular disease like heart attack, stroke, much higher than baseline. And this lasts, 90 days, 6 months, and as well as a year. And also kidney damage. There's many symptoms that persist. Your whole body is at a much higher cardiovascular metabolic risk in addition to the mental, behavioral, because it's not just brain fog. I also want to emphasize the diagnosis of depression, of other mental illnesses are also elevated for 6 months to a year after you have COVID. This is the problem. And even if you do not go to the hospital, you still have this. This is why stopping infection is the key, not just, keeping hospital beds empty.
So in terms of long COVID, is there a certain type of group that this affects more, like people who are unvaccinated or vaccinated, or people who are more immunocompromised than not? Or because I know some people who they're pretty young, my age, 20, 21 years old, who have, I think, long COVID. My roommate got COVID first quarter, and he's still experiencing some of the symptoms, and he's perfectly young, perfectly fit. Is this really just random by chance, or is it kind of more targeted toward a specific group of people?
Yeah, this is very important. And there's a lot of people who think, oh, it's just for people who are immunocompromised or high risk. No, it can affect people who are relatively young and pretty healthy for the most
Yeah.
part. And this it cuts you down. I know many young people, young adults in their 20s, 30s, 40s who have long COVID symptoms and they can't work. They just
Wow.
cannot hold down a job or go to school. And it's now, yes, long COVID affects you more if you're unvaccinated, but I would say that if you're vaccinated, it depends on how recently and how updated your vaccine is. Because
Yeah.
if
Yeah.
you're still relying on your original two shots or one shot Johnson & Johnson, two shots from late 2020 to early 2021, that's very ancient. That's very out of date.
Yeah.
And the protection against long COVID with two shots is only like 15-20%. It's
Hmm.
like lower. It's better than nothing, but it is still not sufficient amount of protection. And there's a lot of young people who are still suffering from this, in addition to elderly and the high immunocompromised. You don't
Yeah.
need risk factors. Bottom line.
Wow, that's terrifying almost. And I want to ask you about our current vaccination rate, which is equally as terrifying, if not more. You mentioned the just completely low vaccination rate that we have, especially in red counties, but also I guess in more liberal counties. How concerned should we be that we don't have a good chunk of the population fully boosted and vaccinated?
Yeah, I think many people did go out and get the original two
Yeah.
shots, and a decent number got the third shot of the original Wuhan 1.0 vaccine. But the issue is that this virus is so heavily evolved from the original Wuhan strain that you need these Omicron boosters. But
Hmm.
that uptake, the public health messaging, the government messaging campaign
Yeah.
around this has been horrible compared to,
Hmm.
we saw early pandemic. So it's really frustrating because this virus seeks to evade us, and we need to keep up with it. And optimally, we need a new generation of vaccines.
Mhm.
There are those in the works that are based on inhaled mucosal vaccines that you can
Oh,
just
interesting. Yeah.
like it's easier than inhaling an asthma medication. But the thing is, the U.S. government hasn't funded them, and right now the best we have are the Omicron variant adaptive vaccines. But again, the uptake in Trump counties are 75% voting. Trump counties are
Hmm.
around 10%. Even in purple districts that are 50-50 Trump Biden, it's about 15%. And even in liberal areas with like 75% Biden voters, it's only around 20%.
Hmm.
Very few counties have anything above 25%. So it's abysmally low. The ignorance right now is that, oh, pandemic is over, pish posh, out of sight, out of
Yeah.
mind.
Yeah.
But again, one death is a tragedy. You
Right.
know, 1,000 deaths is a statistic, and right now we have thousands of people still dying
Yeah.
every 2 weeks and every month. And I just cannot emphasize that. I think here's the analogy. People oftentimes say, oh, the hospitals are not full. Well, do we say, hey, you can go not wear a seatbelt today?
Yeah.
Hospital beds are
Right.
empty. You can
Right.
skip your helmet when you're biking or on a motorcycle. Hospital beds are empty. You know what?
Yeah.
Drunk
Yeah.
driving is legal today. Hospital beds are empty. That's not how we run prevention. Prevention is about stopping disease
Right.
before they even happen, not just mitigating it with a Paxlovid pill or some other monoclonal antibodies, which these monoclonal antibodies don't even work anymore against these new Omicron strains. So we are losing the tools. We're not using the tools that we have, and we're
Mm.
ignoring the actual reality of long COVID debilitating our workforce because
Yeah.
it's
Yeah.
sick. The Jerome Powell, the Federal Reserve, says COVID has taken so many people out of the workforce. There's very high, they say there's low unemployment rates, right? But that's low unemployment of those willing to be employed.
Mhm,
But there's
mhm.
actually really striking shortages of workers, and a lot of workers that are just not in the workforce because of COVID.
Yeah. Well, so it seems like, I mean, against this backdrop of low vaccination rates, I mean, what is the way? How should the government? How should President Biden be? I guess reaching those people going forward. How do you build that trust, or is it maybe not so much a government approach, but rather doctors having individual conversations with patients? What's the right way to approach this and get people to trust in vaccines? Or do you feel like, I mean, for those people who are especially in Trump counties, have they been so ingrained in that kind of right wing narrative around science and vaccines that they're unreachable at this point?
Yeah, I think in certain ways there. I think we've lost the messaging war on,
Mhm,
hey, the
mhm.
need to get these mRNA boosters, because right now the only vaccine.
I think we may have lost. Oh, there we go.
Okay,
Yep.
here.
They're good. Yeah.
The only vaccines that are truly like available as a booster are these mRNAs, because Johnson Johnson, we don't use them. Novavax, it's really hard to find, and
Yeah.
there's not enough of Novavax, which have more variant. But these mRNAs, the disinformation out there, we've kind of lost it. And Biden, I think Biden administration is trying to talking about ending the pandemic, and I
Yeah.
think
Yeah.
that's the ending the pandemic emergency. It's going to be really, really bad because a lot of fewer protection. The vaccines are also much less funding for a lot of the vaccines. Supposedly, the vaccines will then be commercialized.
Hmm.
Hopefully, they're
Hmm.
still free, but that's only free for those with insurance. And right now, the messaging out there, we've completely lost the messaging. I think the CDC has kind of given up.
Yeah. Yeah.
The CDC has also given up on many tracking the variants accurately or timely,
Yeah.
and I think that we've had very poor leadership at the CDC, and I say this as a Democrat who
Yeah.
has been saying we need to do better than what Trump administration did, but even now the Biden CDC has not really done that well.
So, I mean, do you fear then? I mean, you mentioned that President Biden, he's apparently in May going to officially say that COVID isn't a public health emergency anymore, a national emergency anymore. Do you feel like that runs the risk of a new variant emerging, people just getting so relaxed, thinking that the COVID pandemic is over, that we might, come next fall or winter, be stuck with another variant?
Yeah, well, variants are still here to stay, and it's a
Yeah.
whack-a-mole. I'm pretty sure there will be another variant. The variants evolve whenever you give it warm bodies to infect, and they're
Yeah.
still
Yeah.
letting the virus infect millions and millions of people. Not to mention, not just in the U.S. but worldwide. The virus doesn't end at any country border whatsoever.
Right.
I think there will likely be another variant that is even more evasive and waning immunity. People, again, who've been recently infected or previously infected, they think they're immune, but you're immune against the strain that you got infected with,
Hmm.
and only for a period of time.
Oh,
The
interesting.
again, this treadmill that we have, this whack-a-mole game, is we have to stay ahead of it, and if we don't stay ahead of it, we're gonna suffer this economic. Right now, I
Yeah.
don't even talk about health effects because long COVID effects. It is there. People who have it realize it, but if you don't have it, it's out of sight, out of mind. But what people should still realize is the economic effects. Hospitality industry can't hire workers.
Yeah.
Um,
Yeah.
Many of them just don't feel like going, that these kind of high risk jobs are worth it. There's many other jobs, and it's our economy, stupid, in terms of making people care, not just health
Yeah.
reasons but also the economic reasons. And I think that's just completely underappreciated, and
Yeah.
it's a very slow kind of rolling tide, that if you look at hospitalizations, they're at a very high plateau. We just kind of given up
Mm.
on it, and I think that's very unfortunate. It's not leadership.
Yeah, no, this is really alarming to me, and I'm grateful for your voice as well. As I mean, there are many people on Twitter who are pounding the alarm bell on. I follow Taylor Lorenz, Morgan Fairchild. Those are people who are really kind of saying that we are not over with COVID, and
Uh,
so I'm wondering, maybe just to end this conversation, what do you think COVID policy looks like? I mean, for students, it's probably, it's probably not an effective way for us to go back, into our homes and not do in-person learning. But should there still be masks? What should
right.
we be doing going
And I
forward to
think
adapt to this?
right, and I think we need a vaccines plus strategy. And
Mm,
I'm
yeah,
very supportive of vaccines, but I'm realizing the limits of people, wanting to take another needle in the arm, right?
yeah, yeah,
But I think, look, the some people don't want to wear masks. I think wearing masks, N95 masks, KN95 masks is good, especially in super crowded indoor settings. Um, but I think the most effective is air disinfection,
mm,
ventilation, HEPA filters, UV disinfection devices that are safe.
yeah,
These don't cost anything to the everyday user. It costs things to the school and the businesses, but they
sure,
can afford it. And keeping it's kids in school, keeping workers in school. I think it's very cost effective,
yeah,
and they're not polarizing. It doesn't require individual behavior for ventilation, air disinfection, and UV disinfection, filtration. It's not political, right? Like no one says, "Oh, I refuse to enter a building with a HEPA filter on." Come on, like,
yeah, yeah,
or like, how dare you open the window? Like, no, these are not political things. It should be very easy to do. The solution to pollution is dilution, as we say in
yeah,
public health,
yeah.
and 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 right now it's just we are just ignoring it. This is like such a easy fix. It
Mm,
should be a layup to do, right?
yeah,
Keeping kids safe. Like the pandemic did provide funding. Congress did provide funding for these air disinfection devices, but the money wasn't earmarked in any way. Like a
mhm,
lot of people
mhm,
wasted them on other things that don't work. States are holding on to billions of dollars. By the way, every state is sitting on hundreds of millions, if not billions, of pandemic dollars that they're just not spending. They're just waiting it out and hoping that they could spend it, use it on whatever other slush fund projects that they want. But they have these pandemic funding that they could use to buy HEPA filters and
yeah,
a
yeah.
UV disinfection, but they're just not using it, and that's a shame.
That's really interesting. I think that's a great solution. But as you were talking about how this can't be challenged, I mean, I can only imagine what Tucker Carlson would say to his right wing audience. I mean, I don't know if there's anything that will get them to accept these things, and it's like they're going to tell their audience they're trying to control our air or something, and it's all made up
Well,
and fabricated.
well, open the windows. I don't know how opening windows is such a crime or
Yeah.
sin, but I'm sure Tucker Carlson will spin something.
Yeah, like he always does. Well, Dr. Eric Feigl-Ding, thank you so much for joining us today. It's I think important, such an important voice for you to keep on kind of hammering this home and saying that this pandemic is not over, and for us to keep precautions because this is just as infectious. We're seeing hospitalizations going up. I mean, this is still with us, and so hopefully people can be aware of that and get vaccinated and get fully boosted. So thank you so much for joining and all that you do.
I appreciate it. Stay
Thanks so
safe.
much. You too. That was a really alarming episode for me, and just hearing Dr. Feigl-Ding talk about this pandemic right now and where we are. I mean, it's kind of like he said. I mean, I'm a Democrat, but I do think that this administration has dropped the ball on COVID. We've seen this lack of kind of leadership, really, frankly, political will to keep on kind of driving this message home that COVID is with us. In May, President Biden announced that he basically is going to end the COVID emergency, and so it kind of once you normalize that COVID isn't a thing, then you're going to have society that goes completely back to normal, who won't care about this. And I think we're still seeing a lot of immunocompromised people, especially being vulnerable to this virus. We're seeing healthy people get vulnerable to this virus. It's a very concerning issue, I think, for our nation. It's not something that will go away. We're seeing different mutations, and And one of the things that really alarmed me that Dr. Feigl-Ding said is that those who have gotten infected before aren't immune. They're only immune to that strain. And so as this virus keeps mutating, our chances of getting COVID again is just as likely. Just because you got it once doesn't mean that you're immune from it again. And so just an all around concerning episode. And hopefully we can all keep our guard up. A few pieces of news before we head into the weekend. First, there was some news yesterday. Adam Gentleson, who serves as the chief of staff for John Fetterman, announced that John Fetterman admitted himself to Walter Reed Hospital to treat his clinical depression. Apparently, it's gotten worse over the past few days, and it's unfortunate, it's sad, but I think it's really powerful. Obviously, our wishes, our strength, our love is with the entire Fetterman family. This is a family that's gone through so much grief, pain, and for John Fetterman to admit this and to tell and to be okay with sharing it to the public, I think does more of a public service than he realizes. This is, a country, especially young people who are struggling a lot with mental health. He's saying that it's okay not to be okay. Even as U.S. Senator, it's okay to seek help. In fact, that's someone's greatest strength is to go out and seek help. And so I think destigmatizing struggles with mental health is something that is really important. And this is a true hallmark, I think, of someone who has courage, strength. This is leadership at its finest, public service at its finest, because we don't see this enough in our society. Normalizing these types of behaviors and destigmatizing it, I think, is really important. So thank you, John Fetterman, and honestly, just really sending you all of our well wishes. I know everyone watching this hopefully is going to just be hoping for a speedy recovery. You are really needed right now, and we hope that you get better. But thank you for what you did, because I think it's going to help a lot of people. This morning we saw speaking of Tucker Carlson, we saw new news about a bunch of Fox News anchors, including Tucker Carlson, knowing that they spread fraudulent claims about the 2020 election. So there were new texts found in a court filing yesterday. And let me just read you some of them. So Tucker Carlson texted a colleague at Fox News in November 2020 saying, "Sidney Powell is lying, by the way. I caught her. It's insane." Laura Ingraham told Tucker Carlson about Sidney Powell, "No one will work with her. Ditto with Rudy." Sean Hannity said that whole narrative that Sidney Powell was pushing, "I did not believe it for 1 second." So, just like we saw last week in terms of what Trump and Meadows did in terms of hiring a research firm to give them to basically investigate whether or not there was election fraud, and that research firm came back to them and said there is no election fraud, yet they still peddle this 2020 election. Same with these Fox News hosts. These are people who know better. They knew that what Sidney Powell and these lawyers were saying were utter nonsense and BS, yet they continued peddling these lies, and they put millions of people in danger. They are eroding the trust in our democracy. It's really a cynical thing. So next time you hear something on Fox News, just know that these anchors know better. They probably know the truth, but they're intentionally lying to their audience, and that does a huge disservice and is just dangerous for our country. It's dangerous for our democracy, and it's really just an unfortunate situation. And so hopefully all of us, as we talk to our Fox News friends, just know that they are being lied to. They're being fed a bunch of lies, and the goal of it is to make them exhausted and to get them to question our basic functioning of democracy. And honestly, all of them should be ashamed for doing this and knowing what's true, yet peddling lie after lie after lie. That's all the news that we have for today. Next week, we'll be back with more episodes of On the Move. We'll be back every day at 8 a.m. Pacific time, 11 a.m. Eastern time, even on the President's Day. So that's a holiday. I know we don't have school, but we'll still be back with new episodes with great guests. You don't want to miss them. Be sure to tune in right here on youtube.com/Politicon. Be sure to like and subscribe so you don't miss a single episode. And I will see you all next week. Please have a great rest of your weekend and stay safe and healthy. Thanks so much for watching.